Hello, Dr. Simmons here, Ohio Herbal Clinic. I wanted to make a quick video to address the passing of Issue 2, legalization of recreational marijuana in Ohio, and what impact that has in terms of the medical marijuana program. So, as the law exists now, what was proposed and passed, if there are no changes to that, in my opinion, will crush the medical marijuana program. Hopefully that isn't the case. We have a nice, strong program in Ohio, but if there's no updates, then it'll crush it. So the things that need to happen, what'll take place next is the legislators will determine, number one, if they're going to allow the law to come into place, because they have the power to essentially reject it. I think they will allow it to come into place. But the second issue there then is, what form are we going to see? And I think one of the things that needs to happen in this process as they make adjustments to what's been proposed is they need to put things in place to prop up the medical program. First and foremost, they need to consider things such as certain products that are only for medical patients. That's been done in other states. Tax-free products, as well as allowing medical patients to have larger quantities of products. So those are the things that would need to be done by the state legislators to allow the medical program to continue to thrive. In regards to the question of, well, do I need a medical marijuana card now that this has passed? Again, this is not going to happen anytime soon. For those who've been there from day one, you'll recall that 2016, the original House bill for medical marijuana passed. Fast forward 2 years later to 2018, doctors were allowed to speak with patients about medical products and make recommendations. And then a full year later, so we're talking 2019, 3 years after the bill passed, the first dispensary was active in the state. So this is not an overnight process. It's not a 30-day process, not a 9-month process. In my opinion, the first person to walk in off the street into a recreational dispensary, my best guess would be 12 to 18 months from now. So if you need medical marijuana in that time frame, then you need to get a card for the next 12 to 18 months until that happens. So hopefully that answers that issues in terms of, will the medical marijuana program survive, to be determined. And, do I still need to get a card for the foreseeable future? You definitely do. All right, hope that helps. Take care.